So to begin this amazing program, first we are going to have Roxane, so my colleague, assistant professor at Faculty of Nursing at the University of Montreal. She's also one of our researchers at Cyrano. And Roxane received a PhD in Public Health and Medical Care Organization from University of Montreal and a master's degree in econometrics from Université Aix-Marseille. She currently holds a Researcher Scholar Career Award from the Fonds de Recherche du Québec, Santé, and her research agenda focus on improving efficiency in healthcare organization. So thank you, Roxane, for this program and for the introduction.
So thank you, Nathalie. I'm very glad and very honored to introduce this conference. I was asked to do the introduction and to speak about integration. Why is it important? So I will start the morning. I thought it's important to that everybody start the morning with the same baseline. So I will draw a short picture of the concept of healthcare integration, and I will finish with two questions I would like you to keep in mind for all the morning. So most of you won't learn anything here. We are all developed countries are experiencing an increased prevalence of chronic disease, a growing proportion of elderly in the population, and we have a big need for complex and diversified health services. So for what purpose are we interested in health services integration? All health systems want to maximize accessibility, comprehensiveness, appropriateness. We want to maximize effectiveness, continuity of care, and quality of care. Overall, we want to maximize efficiency of care. And there's a point very important. We want to minimize healthcare services duplication. We want to minimize waiting time for patients, and we want to minimize waste of resources. So what's health services integration? We have different types of health services integration, and we need all these types of health services integration to have health services, integrated health services. So the professional integration refers to the extent to which professionals coordinate services across various disciplines. The clinical integration refers to the extent to which care services are coordinated. The organizational integration refers to the extent to which organizations coordinate service across different organizations. The functional integration refers to the extent to which back office and support functions are coordinated. And the normative integration, and not the least one, refers to the extent to which mission, works values, culture are shared within the system, the healthcare system. So here, I don't know if you can read it, but here I made a figure to, I tried to draw a picture of health services integration. So on the horizontal axis, you have the types of integration, the professional, the clinical, the organizational, the functional, and the normative one. You can see under each one, for example, for professional integration, we need inter-professional collaboration. For clinical integration, we need coordination. For organizational integration, the determinant is inter-organizational collaboration. To have functional integration, we need to have very strong and very robust information system. And to have normative integration, we need a big vision which is shared between all the organizations within the systems. You can see on the vertical axis the different levels, so the local level, the regional, and the provincial level. At the local level, you have the primary healthcare organization, you can see on the first line, you have at the regional level the CUS and the regional hospital, and at the provincial level you have the Ministère de la Santé, Ministry of Health, thank you. So you can see I put some arrow on this graph. Arrow represents the arrow represents the vertical integration and the horizontal integration. What's horizontal integration? It's integration between the same level of care. Vertical integration is the integration, the coordination of services between different levels of care. So you can see some arrows are bigger and other ones are smaller, sorry. So, for example, we need strong professional integration between the PHC organization. We need very strong clinical organization between PHC, but also between CUS, regional hospital, and PHC. And if we go at the end, we can see here that we need very strong normative integration between all the levels of the system of care. And if we want to merge different organizations with different culture and values, normative integration is very, very, very important. So I will just finish here my introduction with two questions I would like everybody to keep in mind for all the morning. The first one is, when we do healthcare services integration, what are the benefits for care provider? Will they get better conditions to improve their practice? We have to work in this way, in this sense. And the second one, which is not the least, what are the benefits for patients? Will they get a better experience of care? It's very important today. Thank you.